Thank you for joining us today for the meeting of the New York City Health and Hospitals Board of Directors. Today's meeting is officially called to order. Please note for the record that Dr. Michelle Morse is representing Dr. Ashwin Basan, Karen Sanhilier is representing Gary Jenkins, and Erin Kelly is representing Deputy Mayor Ann Williams Isom, on the three of them in a voting capacity. So next on the agenda is the adoption of the minutes for the board meeting held October 27th, 2022. Are there any questions, comments, or suggested changes? Is there a motion to accept the minutes?
So moved.
Let me then go through names quickly. Dr. Katz?
Yes.
Erin Kelly?
Yes.
Vincent Calamia?
Yes.
Karen Sanhilaire?
Yes.
Michael McRae?
Yes.
Robert Nolan?
Yes.
Enioski Peña Mora?
Yes.
Sally Hernandez Piñeiro?
Yes.
Frida Wang?
Yes.
Manita Kawatra?
Yes.
And Michelle Morse?
Yes.
Being approved. So during the executive session, the board received and approved oral and written governing body submissions from NYC H&H Harlem. The board also received and approved semi-annual governing body reports. These are written submissions from NYC Health and Hospitals Metropolitan. Let me move on to Vendex approval. Since we began the process of approving contracts prior to Vendex approvals, there is one item on today's agenda requiring Vendex approval, and that approval is currently pending. There is one item from previous board meetings pending Vendex approval. Since we last met, no approvals were received. We will continue to notify the board as outstanding Vendex approvals are received. So I'm going to move now next to the resolution, which is item number 2 in your agenda. Dr. Calamia.
Thank you. Authorizing New York City Health and Hospitals Corporation, the system, to enter into a 3-year agreement with Natera Inc., Natera, for the performance of non-invasive genetic prenatal tests to detect abnormalities in a fetus, and IPT, with the system holding 2 one-year options to renew for the total not-to-exceed cost across the entire potential 5-year term of $15 million. This was presented to the Medical and Professional Affairs Committee on November 1 and was approved at that time for presentation to the full board.
Thank you, Dr. Calamia. Do we have a presentation on it? Please.
Good afternoon. I'm Michelle Allen, Systems Chief Medical Officer, and to my right,
Kendra Ford, Vice President, Clinical Services Operations. Good afternoon, everyone. Go ahead. So our background and current state for NIPS testing is, and NIPS testing is a blood sample. Hospitals currently sends non-invasive prenatal tests, NIPS, to various reference labs. It results in variable test costs, turnaround time, and test methodologies. The locations in scope are our acute cares and Gotham facilities. Currently, we send about 6,000 tests to reference labs. The Women's Health Council, in collaboration with Laboratory Services, is seeking to identify a standard reference lab for NIPS testing. Screening including 24/7 access to genetic counseling for both the providers and our patients. Reducing variation from the use of multiple reference labs and tests will allow enhanced monitoring of quality and service performance while providing access to testing and counseling to our patients. Next slide, please. Our RFP criteria, the committee included our Women's Health Services, Laboratory Services, Medical and Professional Affairs, from our IT colleagues, both interface and applications teams, as well as a facility genetics counselor. Our criteria is 30% test quality and technology, 30% integration, 20% client service, and 20% cost. We'll talk about MWBE further in the presentation. The overview of the procurement: on April 21st, we published the RFP. May 6th, the pre-proposal conference held. May 20th, we received 6 proposals. July 20th, the evaluation committee debriefed on the vendor proposals, and on August 2nd, the evaluation committee came up with a final scoring of Natera as the highest rated proposer. Next slide, please. Dr. Allen?
So currently, the American College of OBGYN and the Society of Maternal Fetal Medicine in October 2020 released a practice bulletin advocating that all pregnancies be screened by NIPS. In summary, they recommend that prenatal genetic screening and diagnostic testing should be discussed and offered to all pregnant patients, regardless of maternal age or risk. The cell-free DNA is the most sensitive and specific test for the common fetal aneuploidies. However, cell-free DNA test is not equivalent to a diagnostic test. So that patients who have a positive screening test for fetal aneuploidy need to undergo genetic counseling, followed by a comprehensive ultrasound evaluation, and offered the opportunity for diagnostic testing to confirm the result. So in summary, they recommend that the screening be done, NIPS, if that's positive, to see a genetic counselor, have the discussion with the family, and if they desire, offer diagnostic testing, which would be either chorionic villus sampling or amniocentesis, and dependent on the results of that, follow up genetic counseling. Currently, the New York State Department of Health recommends genetic evaluation for all women interested in prenatal genetic screening or testing. The following criteria delineates women who are at risk: a family or personal history of a known pathogenic variant or mutation, a personal or family history with a known or suspected genetic disorder, consanguinity, women over the age of 35, positive or abnormal results from a maternal serum screening, such as NIPS, abnormal results from chorionic villus sampling or amnio, fetal anomalies identified by ultrasound, exposure to potential teratogens, or a history of a previous stillbirth, SIDS, or 3 or more recurrent miscarriages. New York State Senate Bill S. 8157 has been passed by both the state and the Senate and Assembly, pending the governor's signature. The next slide is a very busy flow diagram, which you can read at your leisure. Natera's NIP product is known as Panorama. Both the sensitivity and specificity are over 98%. Panorama is the only NIPS that uses a specific technology called single nucleotide polymorphism. And Panorama is the only NIPS test that can detect triploidy and give individual fetal fractions on twin gestations. Next slide. Turnaround time at H&H is approximately 5 days. And on the next slide, Natera offers counseling 24 hours a day, 7 days a week, at no additional cost. They offer free pre- and post-genetic information sessions for all patients. Genetic information sessions can be translated, and there's access to a 2-minute educational video. I'm going to turn it back to Kenra.
So thank you, Dr. Allen. The public entity customers, as you can read, are Atrium, SUNY, Lee Memorial, Memorial Health Public, Stony Brook, and Medicis. And within the New York City area, NYU, Presby, Montefiore, Mount Sinai, Hackensack, Robert Wood, Johnson, Yale, and Northwell. Next slide, please. Our MWBE analysis. The services procured under this contract are clinical laboratory services, which are entirely self-performed by the lab except for the general overhead expenses. The vendor diversity team reviewed the vendor diversity databases and found no labs that perform these services. Any opportunity for subcontracting a portion of the overhead expenses, such as courier or supplies, was reviewed by the team, and there was not enough availability or capacity found to set an MWBE goal on the work. After review and analysis, and consistent with the vendor diversity policy, there is no meaningful possibility of participation by diversity vendors. It was recommended that no MWBE goals be applied to this RFP, which was approved and exempt by the CRC, which was approved as exempt by the CRC. No new information was found during the solicitation process that changed the analysis. It is recommended that no goals be applied to this contract. Next slide. Do I read the slide? Authorizing the request to the board authorizing New York City Health and Hospitals Corporation to enter into a 3-year agreement with Natera for the performance of non-invasive genetic prenatal tests to detect abnormalities in a fetus NIPS testing, with the system holding 2 one-year options to renew for a total not to exceed cost across the entire potential 5-year terms of $15 million. Thank you.
Any questions from board members?
Yes. You said we are currently doing about 6,000 tests. Is that a year?
Correct.
And what percentage of the tests would you say are found to be positive in some way?
So I actually don't have that information at this moment, but certainly we'll report back to the board those details.
Okay. And I was also curious about the demographics of the patient population in terms of age, gender, I think is, we could skip, but race and ethnicity.
So sometimes we do need to test the father of the baby, so that's an appropriate question. Gender as well. I think what we need to do is look for you and for the board is to look at who's ordering the test, because we also do genetics in the oncology world and the pediatric world. Look at our baseline demographics, which actually changes from facility to facility, and give you the racial, ethnic, gender breakdown of who we're testing.
And
To see
age.
if we-
Could
we're
do
testing-
age as well?
Say that again?
Age as well?
Age,
Yeah.
yeah.
Great. Okay, that's
Get
it.
that.
Thank
That's a
you.
great question, and we'll be happy to report that back.
Dr. Morse and Dr. McCray?
This is really exciting to be able to expand the service and to be in alignment with the ACOG recommendations. And my question was kind of similar to Sally's. Was curious about the positivity and how much quality control perhaps is done around the counseling that comes through the lab service. If how involved are we in assessing, how good those services are, and then curious similarly about the potential increased volume for false positives and other that might come from such a big expansion of the testing.
For the quality assurance for the testing.
So, great question again, thank you. And I will address the quality assurance for the service in total. So we will measure, we have an infrastructure in place not only from the technical aspects of the test, but also from the counseling services, 2 forums to receive complaints. And we do review that monthly, is the Women's Health Council, which meets monthly, is a forum, as well as direct escalations. And that is actually part of our quality program moving into this. And obviously, we will take actions as we hear so far. The good news is we've had a very positive experience with the counseling services so far.
My worry being, are they going to refer for lots more testing and things like that because of the company? But yeah.
Yeah. The false positive sensitivity and specificity as the denominator grows.
Yep.
So we would have to, so I can't answer that specifically. We do have the baseline data and we do have the other organizations, facilities and systems that we can compare ourselves to, but I think that's something we can build into as time. So this is 3 years. We'll see how the volume grows, how the denominator grows, and if it has an impact on the sensitivity and specificity. I think that's an excellent question. Yep.
I'm sorry, are you projecting significant growth or, and did you budget for that? Or are you thinking it's going to stay at about 6,000?
I think with everything that we know so far, I think that we're going to stay where we are right now, but do want to factor in some slight growth. And certainly we're looking at that monthly to make sure that we stay in control.
You had a question? Okay. Any other questions then? Okay, hearing none, then let me move to a vote then. Dr. Katz,
Yes.
Erin Kelly,
Yes.
Dr. Calamino,
Yes.
Karen San Hilaire,
Yes.
Dr. McCray,
Yes.
Robert Nolan,
Yes.
Dr. Peña Mora,
Yes.
Sari Hernandez Piñero,
Yes.
Frida Wang,
Yes.
Anita Kawatra,
Yes.
Dr. Morse,
Yes.
also Pagan, yes. So the resolution approved. Thank you so much. Next on the agenda is the President's report, Dr. Katz.
Thank you so much. Start with infectious diseases. On one hand, the number of cases of coronavirus has been decreasing especially in the hospitals itself. So I think in the community, people continue to develop COVID, but the number of people sick enough to have to be in the hospital has been very small. And I think one of our great achievements for the year has to be that the state had chosen us to do Paxlovid for the whole state of New York, and it's working very well. Several of you have used the service, and you have passed along your findings that it's fast, it's easy, people are getting the medicines that they need, and I'm very proud. I don't know that there's any other recent example where the state of New York chose Health and Hospitals to be the service provider for the entire state, and we're succeeding at it. So that's very good. RSV has, and Mr. Nolan and I were talking about it 2 weeks ago. He was asking about it, and I was saying, it's all over the country, but it's really not in New York. Well, this week it's in New York. And that's how, infectious diseases work. And we are seeing a number of kids. Our pediatric wards are much more crowded. Fortunately, we have historically more space in general for kids, because if you think about it, so much of hospitals reflect history. Before all of the amazing childhood vaccinations, a lot of kids used to get hospitalized. And then the pediatricians, at least the hospital-based pediatricians, pretty much put themselves out of business with these series, which so declined. In my era, we would hospitalize children all the time for possible bacterial infections because they'd have these high fever illnesses and you didn't know if it was viral or bacterial. And now, because of immunization, so much less. So at least we have the physical capacity in almost all the hospitals to accommodate the kids. We don't have any physical problems because the pediatric wards are generally larger than what our average census is. Staffing is always a bit of a challenge, but we've so far been able to keep up with it. It is worrisome for what the next few months will look like, especially because still we haven't seen a lot of flu. If you continue with if you start getting a lot of flu with a lot of RSV, it will be very tight. We were with the mayor in front of the T building at Queens Hospital, a phenomenal Art Deco building that was rehab for providing housing, both supportive housing and housing for people that's affordable. And as part of that announcement, he talked about our Housing for Health program. Leora has been a great advocate for getting our patients housed. We've placed more than 1,000 patients in medical respite or permanent housing since January 2020, and we're going to work on another 650 affordable homes in the next 5 years. Kenra Ford, who did the last presentation, has been exceedingly great at figuring out how to increase the, it's really decrease the time it takes to get results, decrease the delays, and reduce the costs for our lab tests. The future of labs is, of course, all about automation. Once you can automate the machines, most of the machines, then the per test cost is quite incidental. For once you automate it, you can do 30 tests for the cost of one. It's all about having the appropriate equipment and the appropriate processes. It's also good because there is a shortage of lab workers, and it's very difficult work. It's not, planting individual vials causes a certain amount of repetitive motion problems. This is really work that's best to be done by robots, by machines. Lab people should read slides and do other work that requires much more in the way of intellectual work. And this initiative that she's done will both save us money. NYC Care won a very prestigious award. I have the pleasure of having known Bernard Tyson from my California days, African-American man who ran Kaiser, really terrific guy and advocate for the underserved. When he died, Kaiser put together this award for a program that achieves a major gain in health access, and NYC Care won it. So I think that's amazing. I was out at Seaview for its celebration of 50 years and its 5-star rating as one of the best nursing homes in the US. That also was a chance to celebrate the history of Seaview in curing tuberculosis. We were out at Harlem celebrating the new mural project, which has been funded by the Laurie Tisch Illumination Fund. As you know, there's one when you come into this building, a beautiful mural, if you haven't noticed it, because you're so focused on getting to the meeting. As you leave today, as you go out, look at it on the right. It's a nice mural because it represents us, you'll see all the different professionals and non-professional workers in health and hospitals being shown. And there are murals all over our hospitals and the clinics. And one of the things that I think is coolest about the project is that community members were invited to actually paint parts of the mural. So they actually, while there's an artist who created what the vision is going to be, this is an unusual case where the community got to paint the murals in their own hospitals. And they're all quite uplifting. The book shows all of them. There is a ton, going on in external affairs in terms of federal, state, and city elections. I know many of you watch these very closely. I always ask Bob when I'm unsure, since he keeps best track of this. You saw that the Democrats held on to the Senate. The Republicans have flipped the House. We have some new members of Congress representing us. Dan Goldman will represent us, and in his district is Gouverneur and Judson. Longtime member Jerry Nadler, because of the redrawing of his district, will represent Bellevue, Kohler, and Roberto Clemente. So we will get in touch with them and make sure they have all the information they need about the facilities that they're now going to be championing. In the states, of course, Governor Hochul won another term, and I'm very pleased to say how collaborative she has been when there are issues. She calls us, she talks to us, she hired smart women who were part of the government in New York City, and we have great connections with them. It's really been a pleasure to work with them in this round, and I look forward to the next round as well. I'm going to read in detail the contracts for the public record. So you're aware that we've had a large number of asylum seekers in the city, resulting in Mayor Adams issuing an emergency executive order on October 7th, 2020, allowing the city to expedite its procurement processes to timely meet the needs of the asylum seekers. Our system has been an integral part of the city's response in providing support for the arriving immigrants, and I've similarly authorized limited emergency contracting to support such efforts. Funding for these contracts is being provided by the city under an MOU between us and the mayor's office. So it's not, just to be clear, it's not coming from the funds that we use to support the care of our patients. So the contracts that I've authorized: rapid, reliable testing, medical triage, urgent medical care, intake and registration, distribution of personal hygiene items and food, not to exceed $11,400,000 for a period of 5 months, can be terminated without cause on 30 days' notice. Huron Consulting Services for project management services, which includes overseeing the opening and daily operations of the sites, management of third-party vendors, reporting of project activities, escalation of operational issues not to exceed $18,500,000 for a period of 6 months and can be terminated without cause on 30 days' notice. The Walcott, the Watson, and Rowe NYC for the hospital for the following periods and not to exceed the following amounts. These are 3 hotels. The Walcott, November 4th through April 30th, not to exceed $5,827,500, be terminated without cause on 30 days' notice. The Rowe NYC, November 12th, 2022 through April 11th, 2023, not to exceed $40 million, can be terminated without cause on 60 days' notice. The Watson, November 14th, 2022 to May 13th, 2023, not to exceed $19,980,000, can be terminated without cause on 30-day notice. I know that many board members are going to be visiting these sites, and we're very proud of it. Complicated political issue that we see as easy, which is that our job is to take care of people. And that's what we always want to do. We want to house people, we want to get them the food, we want to get them to settled, we want to get their kids in school. We love working with our sister department, DOHMH, and getting them vaccinated. To us, it's a very straightforward issue, care for people. I'm going to save the last note for just a minute to add, there's been so much going on that even the report, which poor Khaleesi, I think, got at 11:30 last night to distribute to you, is already out of date. So I wanted to point out something I've sent to you today, which Hunter Nursing School got a very large gift from the Lauder family. And they were clear that they wanted to partner with us. They wanted to partner with us for training opportunities for their nurses, and they want to partner with us for when the nurses are completed training to get loan relief and recruitment possibilities all within our system. They see it as a natural partnership between a professional school and a public hospital system. And it's, just great for us because we have been looking around for additional ways to recruit more nurses. Dr. Moss was talking about that earlier. It's clearly we can't provide our care unless we have enough nurses. And the best way is to train them because then they know our system and they feel loyalty to us. So it was a wonderful gift. So I wanted to, close my report and allow us to really appreciate the life of Joe Massey. He represented, I think, the very best of health and hospitals. He was, a doctor who was incredibly committed to the immigrant population served by Elmhurst, who always saw Elmhurst as the most amazing possible place to work because of the international nature of the patients that came there. He combined throughout his career a great academic and science career with a career of service. He worked through the pandemic. As I was touring the hospital, I remember, talking with him late at night. I mean, he was always there at Elmhurst. He was, a great leader, somebody we're really going to miss. We will make sure that to Khaleesi sends out November 30th between 12:30 and 1:30. There will be a celebration of his life at Elmhurst, and people can join either virtually or in person. I know that staff would, throughout the hospital, would love to see board members. Thank you very much, Mr. President.
Thank you, Dr. Katz.
Just a quick question, Mitch, the lab updates we're doing, we also did, took over a building, was it part of Harlem, creating a new lab?
That's with, the lab itself is for Dr. Morse's group.
Right.
It's a DOH MH lab, but a lab that's important to us
Right.
as we fight infectious diseases together. So that is not, I mean, it's very different mission lab, right? It's,
Okay.
that lab is particularly important for testing unusual diseases, right? When you're trying to figure out what is causing it, developing new testing technologies. What Kenra has been so great at is that hospitals produce large volumes of tests that are very straightforward tests, comprehensive metabolic panels, which many patients get, 2 or 3 times a year if they have diabetes or other illnesses, and figuring out how do you automate those tests to get results faster and at lower cost, with fewer technologists ideally, since it's so difficult to hire them, and we want them to be able to do more analytical cognitive work and less pipetting into little test tubes.
Right, okay.
Any,
So is it coming along your building?
Construction, ground broke. So, yeah. So let's hope so.
That's exciting.
any other questions for Dr. Katz or comments? Okay, so thank you.
Thank you, Mr. Chair.
So the committee and subsidiary reports were emailed to you and are in your folders for your review and submission into the record. Is there any old or new business to come before this board? And then the meeting is adjourned. Thank you so much.
Thank you.
This meeting is no longer being recorded.